All right. Hey, doctors of our personal injury doctors elite community, welcome. Today's presentation is exciting, something new that we're bringing to you and your practices in personal injury. Not only that, maybe in your general practice, Dr. Tony, your administrator and founder of our personal injury doctors elite community, bringing you a great professional that we're going to introduce in just a little bit. But a lot of you have been thinking about new things, new treatment measures, and possibly freeing up some time to allow professionals to take over and help with your patients in personal injury, and not only that, in your general practice. And today we have Dr. Christine Arsenault. I think I said that right. Let me tell you a little bit about her. So she has a degree in pharmaceutical, and she a mindset mentor, health coach specializing in Lyme disease, pain, and complex health challenges for over 14 plus years in the health and wellness industry. She's a pharmacist, a functional medicine certified health coach, an author, and a speaker. Great stuff. She earned her doctorate from Ferris State University up in Michigan, and her coaching certification from the Functional Medicine Coaching Academy. She's been featured, get this, in Pharmacy Today, has also authored many multiple books, ebooks, and appeared as an expert guest in numerous podcasts. Some of those are Voice Podcast, Sound Health Radio, Women's Radio Network. She's an entrepreneur who thinks outside the box, as we discussed what we were going to present to you today. And she is a warrior by conquering the Lyme disease, and she has put together a support team that has helped many people since 2019. We're going to bring her live on our mainstream. Christine, welcome so much, Dr. Christine. Welcome so much for our doctors community's presentation live. And we're going to go ahead and let you take over and just give our doctors some of the things you're doing, what we can do for their practices.
So I just wanted to introduce myself a little bit more. I'm Dr. Christine Arsenault. I've been in healthcare as a pharmacist and a health coach for over 14 years now. And I saw that a pill for every ill approach that we use in pharmacy just really wasn't helping patients reach their optimal health. And that's the reason I got a health coaching certification, because I just wasn't quite fulfilled in my career as a pharmacist. And this is a little bit more about my background. After earning my doctorate, I completed a residency. I worked as a clinical pharmacist in a hospital for 6 years. Then I moved from Michigan to California and started managing an integrative compounding pharmacy where we had more of a holistic approach. I also have certifications in functional medicine health coaching, as well as cannabis pharmacy. And I also have my own personal health journey. So I know firsthand what it takes to heal. When I was in my 20s working in the pharmacy as a clinical pharmacist, I was in pain. I was completely fatigued. And I wasn't quite sure what was going on. And I was still able to work, but that's about all that I was able to do. I couldn't even prepare a meal for myself at the end of the day. I couldn't even walk my dog around the block. And even at work, I had to make all of these adjustments just so that I could get through the day. I could no longer take the stairs at work. I would walk into the pharmacy department, put my purse down as soon as I got in the door, and then walk the few doors over to where our lab coats were to pick up my lab coat, because even just walking a few doors down, carrying that extra weight of my purse drained me. So something was clearly wrong and I wasn't sure what. Then I got a cancer diagnosis. I had hospitalization with meningitis. So I had these big challenges. Well, ultimately, I discovered that I had had Lyme disease. I had been undiagnosed for 20 years. And so that was kind of the answer to everything that had been going on. And so I did some deep inner work and some researching and some searching, and I was able to finally regain my health. And it took me about 4 years of this immersive process that enabled me to do that. And that's what led me to found my company, Lyme Support, in 2019, which is my health coaching practices that focuses on people who have chronic Lyme disease, because I really understand their journey. And I just want to point out too, that if you have a patient and their pain isn't adequately responding to treatment, it could be because there's something else going on. And perhaps it's not just a musculoskeletal issue. but maybe it is an infectious disease process like I had, or maybe it's underlying emotions or a stressor in the patient's life that's contributing to their pain experience. And health coaches just have that extra time that physicians don't tend to have, where we can really dig a little deeper and see what's going on in a patient's whole life. So this is what true healing looked like for me. It wasn't just the pill for every ill, like I mentioned, but I had to look at my entire life, and I realized how important nutrition was, and detox and gut health, and how I was sleeping and resting and moving my body and managing my stress and all of these things. And these are the things that I work on with clients in order to really follow a comprehensive, holistic approach so that we can get on top of their symptoms. And so what is a health coach exactly? A health coach, in short, is an expert in change. That's the best way that I would describe it. And we know that change is hard for patients. And so we're their support system as they go through that difficult time in order to make sure they're successful with their lifestyle changes. And this is the definition here that the National Board for Health and Wellness Coaching gives for health coaches. You can read that there, and I'll just highlight that we recognize that the patient is an expert in their own life. So we find those habits, those changes in their lifestyle that they can actually incorporate in their life so that they can be successful and have more sustained results. And I'm passionate about a holistic approach because that's what really helped me, and that's what helps clients that I work with. And so I just wanted to highlight a few programs that we're using a holistic approach to manage pain. And the first is the University of Florida in Jacksonville. They have a new model that they launched last year in January. It's the first known pain coaching program to be implemented in a US emergency room. And it's a collaboration between the ER providers and a grant from the Florida Department of Health. And it's a joint multidisciplinary effort. So it has advisors from pharmacy, from rehab, nursing, chaplains, palliative care, pain management, ER, and trauma. And they help people manage pain by a combination of traditional methods mixed with new coaching approaches and education. And so this program seems successful so far, and they're still gathering data on it. And then I wanted to highlight the US Army Medical Command and their Move to Health program, which is tailored specifically for patients who have low back pain. And they provide an empirical link between 8 different health domains and chronic back pain. And I have the reference up there for you. The next few slides are going to be specifically about the Army's Move to Health program, which I wanted to highlight because it's pretty similar to how I work with clients. And so you can see here, this is the original wheel that they had with the 8 health domains. They then condensed it just for readability, so it's a little bit easier to comprehend. And you can see in the first diagram how mindfulness encompasses the person in the middle. And that's because mindfulness is really at the core of everything their coaches do and how they coach patients. And then they broke down and have extrinsic well-being and intrinsic well-being, and some of those subcategories from the first domain kind of fit under those. So I'll just kind of go through these and explain how they impact pain. So we know that sleep is a huge one. Sleep deprivation has been connected with heightened pain sensitivity and elevated inflammatory markers. At least 2/3 and even up to 88% of pain patients have sleep complaints, and 50% of sleep patients have chronic pain. So we know that sleep contributes to that restorative process that affects pain. And sleep disturbance increases the risk that acute low back pain will become chronic, and it worsens the prognosis for chronic low back pain. Then we have physical activity. And greater physical activity is associated with a reduced risk for developing chronic low back pain. And it's also an effective treatment for individuals with low back pain. And current guidelines establish early physical activity as a core recommendation. And we know that facilitating physical activity for those with chronic pain often requires addressing some maladaptive beliefs, as well as addressing motivation and other typical barriers that can come up for patients. Next, we have nutrition. That is huge for our pain as well. So if we have dietary changes that look at reducing body fat or adapting a healthier diet, that can have a positive impact on chronic pain. Also, diet can affect inflammation. We know inflammation makes pain worse. And so if we're looking at our diet and things in our toxins in our environment, that can help with inflammation. And also hydration levels can influence our pain perception. So that's important as well. Next, we have intrinsic well-being, which includes aspects of an individual's emotional and spiritual life, as well as personal development. And these impact our overall well-being and our pain experience. And so there's a body of literature supporting the relationship between personal psychological traits and personality characteristics and chronic pain. Also, catastrophic thinking or fear of pain can amplify the pain experience and promote the chronicity of it, while factors such as resilience and optimism are associated with improvement in pain and less disability. Also, emotions can affect our pain. I'm not sure if anybody is familiar with the work of Dr. John Sarno. He did a lot of work in this area with addressing emotions in patients in order to treat their pain. And he taught how emotions actually cause oxygen deprivation in our body, which leads to those physical symptoms of pain. So sometimes breathing techniques and mindfulness techniques can really help with our pain experience. Spirituality can also contribute in this area. It contributes to a sense of value, resilience, meaning, and purpose, and it can play a role in pain-related beliefs and coping responses as well. And then we go back to mindfulness again, which is encompassed in this whole coaching program. Mindfulness, or the intentional, non-judgmental awareness of the present moment. It can reduce pain and enhance function for individuals, likely by enhancing their sense of control and reducing that catastrophizing. And then lastly, we have extrinsic well-being, which this would include an individual's physical environment, as well as their work life, family life, and other external influences. And so we know factors such as marital equality and perceived social support and supportive work environments can hasten recovery from low back pain and reduce disablement. So this model that the Army came up with is a shift from a biomedical paradigm to a biopsychosocial paradigm, with a greater emphasis placed on connecting patients with health resources for self-management, with the focus of the importance of maintaining physical activity and addressing the role of psychological and social factors as being either barriers or facilitators of their health. And so instead of focusing on disease management, they're really focused on health and self-management of patients. And this figure just shows the exact way that coaches work with patients during the Move to Health program. It's a 6-step process where the health coach leverages motivational interviewing and information from the personal health inventory to guide the patient through a series of conversations about behavioral lifestyle choices. The patient then chooses which domains they want to prioritize, and the health coach helps implement the plan by using SMART goals. And so the acronym SMART in SMART goals stands for specific, measurable, attainable, realistic, and time-bound. And they work through those SMART goals and are either self-managed or they're referred to a specialist if needed, depending what comes up in these sessions. And motivational interviewing is a technique we use in health coaching. It's an evidence-based method to support people who are uncertain or ambivalent about setting health goals or taking the steps to achieve them. And the health coaching approach uses empathy, positive psychology, and non-judgmental inquiry to build motivation for change and to help sustain that change in patients. And so I wanted to highlight my own 6-step process. Again, I chose the Move to Health program because it was pretty similar to the way that I work with clients. And so in my own healing journey, I boiled down those 4 years of my healing into these 6 steps. And these are the steps that I guide clients of mine through. So we start by assessing the situation, which we do through intake forms. We figure out where the patient is most motivated to make changes. And we look at their overall vision and make sure we're tying in goals to that vision so that the goals are intrinsic and they're more likely to be successful if they're tied into the overall vision. Then in the learn phase, I provide various resources based on the patient's needs, what they most need education and support around. Let go is all about realizing and letting go of things that are no longer serving us, whether that be toxins in the environment, negative thought patterns, gut health, things like that. Transform is about transforming habits in our life. Now that we've let go of things, we have room for new habits. We focus on transforming those everyday habits. We're also reprogramming our mindset and working on some identity work where we're rewriting the story of their relationship to their symptoms. For received, we dive into the mind-body connection a bit more. We explore mindfulness, meditation, maybe some subconscious beliefs that are standing in our way. And really, a lot of times for patients, it ends up being about self-love. And then celebrate. We celebrate our wins along the way to keep the patient motivated. I use positive psychology and character strengths so that I'm focusing on what is right with the patient instead of what is wrong. I just wanted to highlight one of my clients, Kris. Just have a case study example here. Kris came to me with chronic Lyme disease and pain. However, the most pressing issue for him was probably his anger issues, because this is really affecting his family life and also his lack of confidence. So he wasn't sleeping, he had lack of energy. This was affecting the way that he showed up at work. He just wasn't feeling good about himself, and he was anxious and he was depressed. And so one of the things that he really was struggling with was getting up in the morning. So sometimes he would sleep in past noon. Other times he would have to get up to take his kids to school. So he would do that, and then he would go back to sleep until 2 p.m. when he was supposed to be working from home. And he was basically just barely hanging on to his job. And he was in sales. He was used to being a high performer, winning awards. So this was really affecting his confidence. And after working with me for 3 months, we really honed in on his sleep routine, and we shifted the energy. So he was able to get up at 4 a.m. even on some days. And he was regularly going to bed around 8:30, 9 p.m. And he said that now sleeping into him means 7 a.m., not 2 p.m. He also stated that he definitely has more energy than when we started, still not as much as he would like, but enough that he is thinking about working out again, which is huge because working out was not even on his radar before that. He stated that his anger issues calmed down severely, and he stated that the anxiety was still there, but he's managing it better, and that the depression has gotten better from talking things through with me. He even mentioned that he got his swagger back and he felt stronger and more like himself. And he noted that that was a huge improvement, that he has his confidence level back, and he felt like he was honoring his self-worth. He mentioned that he's eating better and doing better for himself, and he needs to continue on this path of doing better for himself. He acknowledged that he now takes life in instead of just going through the motions, and he focuses more on his family and the important things in life. So this was a huge inner shift for Kris and the way that he shows up in the world and feels about the world. Next, I have one study that I wanted to review, and I'm going to go through this pretty quickly for time's sake. So I do have the reference here, and I will send it out in an email afterwards as well if you want to take a closer look. It's called Health and Wellness Coaching Positively Impacts Individuals with Chronic Pain and Pain-Related Interference. This was a health coaching study that used telephone coaching for a year long. There was 419 participants originally enrolled. They received questionnaires at enrollment 6 months after and 12 months after. There was 213 patients that had 6-month outcomes and 181 that had a full year data. So out of the 419, 181 actually finished the program. The average attendance for the people who did complete it was 92%, which is pretty high. It was 75% average attendance for those who did not complete the program. And this was done via telephone. They received 30-minute one-on-one coaching once a week, and then 60-minute group coaching once a week as well. And this is the areas that they received support in. You can see there: pain education, self-care skills, goal setting, self-monitoring, social support, and career guidance. Here are the demographics of the study participants. I'll just point out that it was mostly Caucasian females in this study. And here are the results. So there were statistically significant results in all of the areas except for fear, and specifically large effect sizes for pain intensity, mobility, vitality, negative affect, and composite pain-related functioning. And the mean satisfaction score at 12 months was 48.15 out of 50, and the median score was a perfect 50 out of 50. So you can see patients that completed the whole program were quite satisfied. And so these are the conclusions that the author came up with, that this study finds that the potential clinical utility of health and wellness coaching improves pain intensity, as well as psychological and physical pain-related functioning. And then I have another client case study. This is Beverley. Beverley came to me with chronic Lyme disease. She had a lot of neuro issues. She had a lot of gut issues, and she had a lot of pain in her joints. And her biggest complaint was not being able to hike with her husband, which was her favorite hobby. And so after 3 months of working with me, she was able to go hiking in the Los Altos Hills with her husband, which is pretty strenuous, a lot of ups and downs, with minimal pain or even no pain on some days. And I have a short 2-minute clip. I'm gonna skip it for time's sake for the presentation, but I will send it out in the email if you want to hear from Beverly in her own words of what it was like working with me.
My name is Beverly.
See if I can, there we go. And so this is why my program works, why the 6 steps work, is I sum it all up by what I like to call the empowered healing approach. And so patients are successful in implementing lifestyle changes because of the process that we go through. They receive a lessons library, which is various resources to reinforce educational concepts and different homework assignments and activities to really kind of practice new techniques that we learn. Magical mindset is another piece of it. And I call it magical because your mindset has such a profound ability on your ability to heal, and a profound effect rather on your ability to heal. And if we can tweak somebody's mindset and craft a healing mindset, we can just see shifts so much quicker. And then habit hacks. We're looking at their lifestyle, the things that they do every day, and where we can make just little adjustments that are going to make the biggest impact so that they're going to want to sustain those changes in order to keep seeing results.